Cases of emphysema and COPD, it's an area where the Buteyko method really shines.
And I was going to come home to die. I was in a terrible trouble. But I was in awful trouble. I was breathless. I couldn't breathe. I had terrific pains in the chest.
Bronchitis I had from a child, and then the pneumonia. And when it escalated to the point where I ended up in the hospital for 4 days a year ago, I just thought, I don't want to go down this path. And I was getting a little desperate as to try to find out what I could do to help myself.
Along with the emphysema, I had a thing called costochondritis, which is where that was giving me enormous pain, see.
Emphysema and COPD sufferers invariably have a low level of alveolar CO2. And this is actually, physiologically speaking, what causes the breathlessness and what causes the symptoms, which, as all patients know, is never ameliorated by asthma drugs. It is helped a little by steroid, of course, but not helped by oxygen particularly. In fact, the disease usually becomes worse with the administration of oxygen. But just after a few weeks of practicing, emphysema sufferers and COPD sufferers can actually sustain reduced breathlessness. They can climb a few extra stairs. They can walk a little further. They are less reliant on medications. So it's a very, very clear-cut case for cause and effect.
And lo and behold, within a matter of a week, things were getting better.
And the other thing is, I often could find myself wheezing, especially if I would go up a flight of stairs or if I would be exerting myself physically. I was out of breath, I was short of breath, and I don't find that anymore. I can go up the stairs, I'm not breathing hard, I can do physical activities, and I really don't feel the same wheezing and trouble breathing that I had before. Well, I started actually the course in September. I think it was September the 14th of 2015. Yes, and August I had another bout of pneumonia. And since I started the course, I have not been sick one day. And this winter, even though we've had a mild winter, there were all kinds of strange flus and sicknesses and things going around. And even with my grandchildren around being sick, I was not sick one day. And to me, that was really something. And I thought I haven't done anything else different other than taking this course. So that really convinced me that what I'm doing is helping my situation.
We're not yet even talking about reversing the pathology of emphysema and COPD, because in many cases that's not a practically applicable option. But to reverse the symptoms, to slow down and stop the progression of the disease, and to most definitely improve the quality of life, that's realistic. That can be achieved. I can't think of a case where within a few weeks there was not incontrovertible, obvious improvement in symptoms and their ability to walk further, to require less medication, to feel better, and to get a better quality of life. Is it easy to practice? Do they find it straightforward and simple and pleasurable to practice? No, they don't.
Yes, it is difficult. I've often said to people, this is probably one of the hardest things I've ever done in my life, especially at my age now, because there are so many habits that need to be changed, and that takes time. And so I think perhaps the thing that I would share with people most often is it's something that will, if you're not a disciplined person, it will teach you to become disciplined if you really want to get better. And I think consistency, perseverance, all those good traits that we all need, I mean, that's the plus that comes with feeling better at the end. And then you get your energy back, you get all these things back that I haven't found any other way in all my years to find doctors giving me that kind of thing or any alternative health method. I find that this, yes, the onus is on the person doing it, so you get out of it what you put into it. And I'm thankful because I can see a big difference already in myself.
I would never want to say it's easy. I would never want to say that, it's a passive treatment that's some kind of miracle. Patients with emphysema and COPD will actually have to work and work fairly hard on their exercises, but results are routine. Results are in evidence, sometimes within a few days, sometimes within a week, sometimes, well, I would say most definitely, always within 10 days, there are incontrovertible results for sufferers of emphysema and COPD. That's what I can say.
Oh my God, it changed my life. It was incredible. I didn't die as
You, because I really feel that I'm so thankful that I found this method and that it has really helped me to this point. And that's honestly from my heart. It's made a big difference. And to think you don't need medication, to me, that's the best thing yet.
Really, really grateful that I've got this this method, and it's basically the understanding of the importance of CO2 and the relationship between CO2 and oxygen,